Welcome to Friday Friends, RI Elder Info's weekly look at the organizations and individuals providing resources for Rhode Island seniors, caregivers, and professionals.
Good morning, everyone. Happy Friday. I am Deb Burton, the founder and creator of RI Elder Info and rielderinfo.com. And if you haven't seen me before, every Friday at 9 o'clock, I host the Friday Friends Show, where I interview different organizations from around Rhode Island that are doing things that you need to know about. So it's really important that you hit the like button and that you hit the share button, because I promise we're going to be talking about some stuff today that you or someone you know is going to need to know about. Before I get into too far, I did want to say it does look like that Storm Henry is going to be tracking up the coast. So you want to start preparing, make sure that you have enough water, you have your cell phones charged, and you have any extra medicine that you might need set aside safely. So if by some chance you need to get out of your house, maybe you lose electric or some other thing that's not so fun, that you are prepared and you're not scrambling at the last minute. So you do want to make sure that you stay safe and listen to what the news is reporting as far as the storm goes, because we want to make sure that we see you all again next Friday. So what I say every week is this would certainly not be possible without the support of our donors and our sponsors. And I have to give a huge shout out to Shirley and Diane from New Hampshire. You know who you are. Your donation was incredibly generous. It's going to allow us to update some of our technology so that we can reach more people. And I'm really appreciative of what you have given. We are also very grateful to our sponsors. So big shout out to Oak Street Health. They're having a block party at the Woonsocket location over by Planet Fitness this afternoon. And the Broad Street location is having a block party tomorrow from noon to 6. So if you want to meet me in person, come on down. I will be in both places. Be happy to say hi to you and answer any questions in person that you might have. Big shout out to United Healthcare. They are doing some really amazing things for both Medicare and Medicaid beneficiaries. There are so many resources available for veterans, for just regular things that you need on a daily basis that maybe other benefits don't cover. You can get a $25 gift card to your local pharmacy to buy anything you want. So really some cool programs. United Healthcare is really thinking outside the box to be able to meet their customers' needs. Also, love Tamarisk Assisted Living over in Warwick, right over by the mall. It's a real family atmosphere assisted living facility. So if it's something that you need for your family or for yourself, I encourage you to call Susan or Sean, and they will treat you just like their very own family. Of course, what I do is not possible without the magic of D&B Studio running behind the scenes here. You seldom see Ben, but he is alive and well back there and making sure that this goes great. And also England Studio, who is responsible for maintaining rielderinfo.com and helping us get the word out about all the cool things that we are doing today. So I would like to welcome to the stage today, Tara Tang and Lulu from Butler Hospital. Hi, how are you?
Hi.
How are you, ladies?
We're good. Thank you so much for having us today, Deb. We're really excited to speak with your audience today.
Yeah, so tell us, why are you here? What is the Pointer Study? What is the point of the Pointer Study?
Excellent. That's a great question. So the U.S. Pointer Study is a landmark national trial, and it's one of 5 locations in the nation. New England has their own location here, and it's looking at the lifestyle, diet, and exercise changes to see if positive changes can help improve and protect brain health and memory as one gets older. So that's really the what we wanted to share with the audience today. And it's a great way to participate and maybe start in clinical research. And we're going to talk a little bit more about what that actually means and involves, because there's no investigational medication at all in this particular study, which I know can be really scary for a lot of people. And so it's a great way to start, maybe dip your toe in the water, but it's even better because it's going to hopefully show that you can make these positive changes right now. You can protect yourself as an individual. You can improve the health of your family and your community. And I think that's a win for everyone, especially in these really trying times still. And go ahead.
Yeah, I had a quick question. So there's been a lot of talk on the news about a new medication that came out and how it's treating Alzheimer's. So is Alzheimer's still a problem out there? And, is it all Alzheimer's? What is the difference between Alzheimer's and dementia and those kinds of things? Like, is it still a big deal now that new med is out?
Sure. So I think you're talking about Aduhelm. And so it is an amyloid lowering treatment. It does not cure Alzheimer's disease, but it is absolutely still an issue, and for a variety of reasons, because there's a lot of different types of dementia. And we're going to, it's a great question because we still get that. What's the difference between dementia and Alzheimer's? And it absolutely is something that we should still continue to be looking at and doing things right now to help prevent that. So the main idea is that dementia is an umbrella term, right? And it just talks about a reason why that there is memory loss, how that it explains why. But Alzheimer's itself is the most predominant form of the reason for dementia. Okay, so it accounts for about 60 to 70% of all diagnosed cases. And it can include, dementia can also include not only Alzheimer's, but it can include Parkinson's disease, Lewy bodies, frontal temporal, and vascular disease as well. So like say if someone has a stroke, sometimes that can contribute to dementia, but that isn't Alzheimer's, right? There's a different reason for that. Alzheimer's is a degenerative brain disease, which happens and worsens over time. It is these amyloid and tau plaques that we've identified as, some of the hallmark reasons why the disease happens, kills off the cells and the neurons, which prevents the connection in the brains. And so that's why you start having those memory issues over time. And the thing is with some of these amyloid plaques and tau, we have those naturally, but sometimes they don't clear out properly. And so these can be building up 10, 15, 20 years before you even realize that there may be some memory loss happening. So that's why it's so important to take a look at things right now early, right? In your 50s, even your 40s, 40s, 50s, and taking a look at that now. So you may not have to worry about that later on down the line. And that's why US Pointer, we feel, is really important to talk about that. I think the other thing that's really important, Deb, is to make sure that everyone realizes that dementia and Alzheimer's is not normal aging. That should not be happening. We all forget our keys where they are sometimes, and we forget where we park our car because honestly, we're really distracted these days. And that doesn't get necessarily ingrained in our brain. But those when our memory loss kind of affects like our daily habits, if we're really good at cooking, say for example, and you got that one recipe that's yours, and then you forget how to make that, then that might be something that you want to take a look at. If you're getting lost in your regular neighborhood that you've known like the back of your hand for 20 years, again, that might be something to look at. That's when you should start worrying about it. But I really want to impress upon your audience that this is, these are not normal aging. You shouldn't just be like, they're getting old, Yeah.
And, it's funny. We talk about forgetting things, going into a room and forgetting why you're in there or getting really distracted. And I think, in the last year and a half, there's been a lot of social isolation and loneliness. We don't have people to talk to. And that can really weigh a lot on our brains. But the funny thing is, as we get older, as we forget things, we kind of say it's because we're older. But when our teenagers forget things, we don't say that they have dementia.
No.
It's like, no, you're distracted. You have a lot of things going on. So it's things like that,
right.
That, it's that ageist stereotype that, of course, as we get old, of course, we're going to forget. And it's just not true. We could still be just older teenagers. I think I am.
That's true. There's definitely days, right?
Yes.
But I mean, I think, and you mentioned the isolation. I'm so glad you did, because it has been something that's weighed on so many people. And I think that's one of the things that we can do through activities like this, even if it is by Zoom, is just keeping the brain engaged and keeping you socially engaged, however that may happen to look for you right now. So I think it's really important. And again, I'm hoping that, Pointer might be one way to help people with that.
Absolutely. So how do people get involved with the study? What's the study criteria? Who can participate?
I think Lulu's got that covered.
I have the answer for that. So we are looking for people who are ages 60 to 79 years old, who are not regular exercisers, and folks who are not experiencing memory loss at the moment, but have a family history of memory loss. So those folks are definitely encouraged to join. We're definitely recruiting a diverse population. And if people are interested in joining, they can go onto our website, which is www.butler.org/pointer, or they can give us a call, and I can get you that number. It's 401 Pointer, but let me just get that. So it's 401-764-6837. And then we also have an email address. It's pointer@butler.org. So if anyone's interested, they can give us a call at our outreach team, and we'll be happy to go over. There's an application process. So we're happy to go over the application process with everyone. And then once people sign up, then the study team will be able to determine if they are eligible to move on to the next steps.
And you said that's butler.com/pointer?
It's butler.org/pointer, correct.
Okay. And then they can call the 764-6837?
Yes. And
That's cool.
yeah, they'll get in touch with either Tara, myself, or our other outreach coordinator, who's Athena. And like I said, we're happy to answer any questions and go over the application process with them.
And so when you say you have to have a family history, does somebody have to have been like formally diagnosed with Alzheimer's or other kinds of dementias? Like, do they have to have died from that? Or can you just know that, like, back in the day that your grandmother, she used to get confused?
Yeah, so not necessarily, passing from Alzheimer's or dementia, but just, a family history of people who have experienced some sort of memory loss.
Okay. And so is there such a thing as normal memory loss?
There is, right? I mean, over time, we have, our brain is just like this massive computer that does so much for us on a daily basis. So over time, things kind of get a little bit, bogged down a little bit. And again, we talked about distractions and concerns and worries and things like that. And so that can, contribute to some temporary memory loss. But if you can remember, like, you walk into a room, the classic case, you walk into a room, you forget why you're there, but you walk back out, and then it kind of, you remember, oh, okay, I wanted to go and take a look at this particular book or notebook. That's okay. If you forget where you put your keys, that they happen, today you put them on the table, but normally you put them by the front door, and then you just kind of recalibrate yourself, and then you realize that's okay. Okay. If you forget why the keys are used, then maybe that's going to be something to consider. The other case, when I was talking, you're talking on the phone, you've parked your car, you're walking into a store, you come back out, where in the world did I park my car? Yeah, exactly. All the time, right here. But that's okay. You kind of like walk maybe an aisle or so, and then you're like, oh, okay, I parked it over here. So that's a little bit part of the normal aging. It's just when you start forgetting perhaps the reason why things are being used, then that's when we need to start worrying. Whatever your normal baseline is, if you start to kind of deviate from that, then you should be taking a look at assessing that.
Sometimes it's not something that we recognize when we're doing it, but our families and our friends see it.
Right.
And so we're not seeing that we're forgetting things, but our family and friends are seeing it, which tends to, I don't know, make you want to argue that, no, I didn't forget. So when you're seeing a loved one who is forgetting things, and it seems like it's a little bit beyond what could be normal forgetting, what can family and friends do to kind of encourage someone who doesn't know that they're doing this to participate in a research study or to go seek out a doctor to get the help that they may need?
I think there's probably depends on the individual, right, Lulu?
Definitely. Yeah, so I mean, we definitely have family members who call our outreach office with concerns about their family member, and we definitely support them and provide resources and education to them in regards to our program and our clinical research. We have a registry where people can join and participate in research. And then we also have, neuropsych testing here at the program. If people want to get that baseline kind of screen to see where their family member is, we do that testing here as well. So there's definitely a lot of resources that we can do to support the family member and even the family if they need the help, for sure.
And the Alzheimer's Association does a really nice job. I mean, they're the experts on the caregiving part of it, and they provide a ton of resources, like as simple as the 10 warning signs of Alzheimer's disease, and what to be looking for and how they can reach out. And they have a 24/7 hotline in several languages, so that they can speak with family members and kind of help guide them in sort of the way that they should perhaps be approaching things and whatnot. And it's, again, it doesn't, like Lou said, trying to find that baseline. That's always a good thing. You always want to compare yourself to yourself. So even just saying, hey, you're at a certain age, maybe we just take a look and see where you are right now. And if the conversation lends itself in that way, maybe just having that direct talk with the loved one, saying, we're really concerned about you. This is why. Would you consider talking to your doctor first, talking to whoever you see on your primary care, and then seeing if maybe we need to take a look at a specialist. And, just like everything else that we have with our health, we want to catch it sooner than later. And so maybe that might be another approach as well.
So is dementia a real issue in Rhode Island? And not to say it's a fake issue, but
right.
Is it prevalent? Does it happen a lot in Rhode Island?
It does. And, our director, Dr. Stephen Salloway, always has been saying it's an epidemic and the pandemic. So specifically in Rhode Island, there are about 24,000 people who are suffering from Alzheimer's disease. If we keep on the current trajectory that we're looking at right now, by 2050, we could be looking at 27,000 people with Alzheimer's disease. And so that's just the individuals who have it, but we also have to consider the family and the loved ones who are caring for that individual, right?
Yeah.
So that's about 38,000 caregivers right here in Rhode Island. And they're providing 48 million hours of unpaid care, which can be valued at $1 billion.
And that's just here in Rhode Island.
That's just here in Rhode Island. We won't even go national, right? Just at the moment, but in Rhode Island here. And all of those caregivers also suffer from the stress of it all, and then have resulting in chronic conditions for themselves, depression, poor physical conditions. And so it's not just affecting one individual, right? It's affecting an entire family, entire communities and generations, because many generations, in certain families, they're taking care of each other. It's really stressful. It's a lot. And so, again, we're trying to find ways to help everyone become healthier as a person, a family, and as a community. And that's why we're really excited to bring US Pointer here to New England.
That's awesome. So there are other research studies. Why should people join the Pointer study versus the other? Or can you be in multiple studies at once?
So for the US Pointer study, one really, really good thing about it is there's no drugs involved. We're looking at lifestyle interventions, changes to your diet, changes to your physical activity. So folks who, are not keen on, joining research that involves drugs, this is probably the research study that they can definitely join. Like I said, we're looking at how diet and exercise affects brain health. So eating better, eating a Mediterranean style diet and exercising, we're hopeful that can definitely protect memory in the future. As for your next question in regards to participating in multiple research studies, usually the answer is no. When you're in one research study, we really want you to focus on that one particular research study. But, once that research study is done, you can definitely look into, other research studies in the future.
So from what you're describing, diet and activity level, is it okay if people maybe have high blood pressure or diabetes? Can they still be in the study? Because that a lot of times goes along with the general need to eat better and exercise more.
Yeah, definitely. That's definitely one of the things that we're looking for too for the U.S. Pointer trial. If you do have, a little bit of an elevated high blood pressure, high cholesterol, diabetes, because those types of conditions do kind of help with they affect the memory. So we're definitely looking for folks who have that type of disease.
I have heard heart health is also brain health.
Yes. Yes.
Very much so. Very so. I think it's a twofer, good for your heart, good for your brain. You can't go wrong with that.
Exactly. So if it involves physical activity and eating, I don't know how much you're able to share. Do people get cooking tips, or are you required to like go join the gym and or a running club, or how much of a time commitment does participating in this study take, and how involved is it to be in the study?
So for this study, there's two groups that we're looking at. So we're looking at a structured group and a self-guided group. So folks who are eligible, they'll be randomized into one of these two groups. So randomization means like flipping a coin. So depending on the group that they're involved with, actually both groups will have a navigator. So that's like a team leader, and that person will provide resources and support to each group member. So like you said, they'll receive diet tips, they'll receive recipes, they'll receive, physical activity information. And so that's for both groups. But depending on which group you're in, can focus more on the time frame. So for the self-guided group, they're meeting 5 times a year. And then for the structured group, they're meeting once a week. And so both groups are meeting at a neighborhood facility. So it is really a community effort. And then people are coming into Butler every 6 months for health screening and blood test and memory testing as well.
So if it can be a group, if you're doing a group meeting, is this something where, I don't know, if I lived in one of the high rises for older adults, could I bang at a bunch of my neighbors' doors and say, hey, let's go do this, and do it kind of like as a team effort? Is that possible?
So no, the groups are structured here, and so we assign folks to specific groups. But the groups will definitely meet in your neighborhood, in a neighborhood facility. So you won't have to travel to Butler. So let's say you live in Newport or West Warwick or wherever you live, we'll definitely have a group setting and a group meeting in your area.
Oh, that's good. Okay. So if I'm in Westerly, I don't have to drive to the east side of Providence, because I can only pack a bag so many times.
Exactly. Us Rhode Islanders don't like to drive and travel far. So no, that's the really good thing about US Pointer is it's a community-based research trial. And so wherever you live, we're really hoping and we're really trying to get group activities in your area.
And actually, one of the questions on the survey that we have you fill out is asking your availability during the entire week, including weekends, and during the time period. So like morning, afternoon, evening. And so when you fill that out, we purposely look at that. And so that we can say, all right, this group of individuals can meet, say, in the evening on a Thursday. And so that way we can kind of plan it out a little bit better. So not only will the navigators know where they need to go, but then the individuals know that they can be with people in their neighborhood and that they can meet at the same time, and they don't have to restructure their day.
And you said it takes about a year.
It's a 2-year study, actually.
Okay.
It's a 2-year study over the course of time. So, and for an Alzheimer's prevention study, that's pretty short. I know that people are like 2 years, wait, but a lot of studies do take 6, 7, 8 years. So 2 years is really a deal.
Absolutely. And you're only meeting, sometimes once a week. So to find if you qualify to be in the study, do you have to get blood work done? Do you need any x-rays, MRIs, CAT scans, anything like that?
So there's no MRIs or CAT scans or anything in this study. There is blood tests involved. And then there's also memory testing involved as well.
And will my insurance cover that blood work? How much do I have to pay to get that to even find out if I qualify. How much, is my insurance charged? Is it going to go up or anything like that?
Yeah, so when you participate in research, all of the cost is covered by research. So you won't have to put anything, you don't have to, your health insurance won't have to be involved. Everything's covered through the research study.
And it's not part of your electronic medical record as well.
Yeah.
Okay, because I was going to ask that too. So if you guys find out that, yeah, maybe I do have dementia of some kind, is that something that gets shared? Well, do you tell me? And does that information get shared with my doctors? Or even if my loved one is maybe helping me with the study, do you tell them that I have dementia?
So within this study, that's something that we hope we won't see. So within other clinical research studies, there are, we would be telling you if there was a concern, right? At any point, that's absolutely something we would do. Just like with everything else, though, you choose who you can share that information with. Even if it is within the loved one, there has to be releases signed, just like you do at your regular doctor's office, of who you can share that information with. Again, within the context of clinical research, that information isn't shared with anyone unless you want it shared. So if you do want it shared with your primary care provider, you have to sign the release, just like everything else. We have to be HIPAA compliant. It's a very important piece of it. If we feel that you need additional workup, then certainly we have the resources that we can provide to refer you to whomever you need to see. Safety is the number one priority here, and making sure everyone has the resources that they need in order to be healthier, including if it involves additional workup. So that's something that our program can provide. But again, we don't share that information if it's found within a clinical research setting, unless you explicitly say that you want it on.
So if it is, then it can be kept secret until the participant is ready to share that information with their family.
Mm-hmm. But we do encourage having a support network. I mean, many of our clinical trials have what we call a study partner, and that is someone who can not only talk to the clinicians about, their loved one and how they're doing and answer questions, from a different perspective, but also to really support them on the journey that they're going through, regardless of what their memory status is, right? You want to have someone who can support you as you go through this journey and you learn different things about your own health. And to that very point, if you do happen to have a diagnosis, what are you going to do about that? And you really do need a village to help manage everything and get everything set up the way you want to. I think that's also a really important piece about all of this, is that this is your decision. Clinical research is always your decision. Even if you say, I want to start doing this, and then we hope you won't, but if you decide for whatever reason that you don't want to participate in research, you can absolutely say, you know what, this is no longer for me. And then that's your choice, and that's perfectly fine.
So you can start the study, find out, I don't want to do it, and you can quit.
You can.
Yeah.
We hope you won't, but
Right.
Yes, that is 100% your right as a patient and an individual to do that.
Yep. And so again, what was the criteria to be part of the Pointer study? So
we are looking for men and women 60 to 79 who are not regular exercisers, and then folks who do have, high blood pressure, high cholesterol, diabetes, and then people who are not experiencing memory loss currently, but like I said, have family history, like a mom, a dad, a sister, or even a grandparent who may have some memory loss issues.
So those folks maybe who are going to work today, they're in their 60s,
Yep.
and their mom or their granddad maybe had dementia.
Yep.
Those are the folks you would love to hear from.
Yeah, definitely. We would love to hear from those folks.
And if I could also put in just one more request as well. One of the most important things about clinical research is that we need diverse participants to make sure that everything that is being studied and looked at in the data that is represented in that study represents all people, not just one particular group. African Americans and Latinos are 2 times and 1.5 times more likely to develop Alzheimer's disease. So, and they also have additional comorbidities, unfortunately. Studies like US Pointer are looking to have about, for us, 23% representation of the African American, Latino, Asian, Native American populations be part of this study. And I know New England has a very diverse group of people. We would love to have conversations with you. And we know we need to earn your trust, 100%. So we are willing to have that conversation with you. And for our team, we can speak in English or Espanol. So that would be something that we would love to have, and so that we can answer all of your questions in whatever time frame is necessary for you. But we're really, really encouraging people from diverse backgrounds to participate, because we feel that this is such an important way to help keep, again, the individual, the family, and the community healthy. And we feel that this can also exist and continue on long after this study is done.
And you know what? If you are Nana or you are Pop, participating in this study may give you the tools necessary to remain healthy longer. So you can see those grandbabies and great grandbabies grow up and get married, and provide the education and knowledge to your children and grandchildren and great grandbabies, what it takes to keep your brain healthy. So I think that that's something too, that it's not just necessarily for yourself, but you're gaining information that you can share with the generations behind you.
Absolutely. And we know that so many families live in multi-generational households. So what a great way to bring the family together. You know, you can be talking about this with the 3-year-old as well as someone who, you know, is in their 70s. And what a wonderful way to do that. And you know, food always brings everyone together. So how can you make those family recipes a little bit healthier, right? And so that everyone can still enjoy it and enjoy the flavor, because we don't want to mess with abuelo's receta. Okay?
No.
You really don't want to do that. But you can probably take a look at it and maybe tweak it just a little bit so it's a little bit healthier, and maybe even make a competition out of it.
There you go. So it sounds like it's a fun study. It doesn't sound like it's overly burdensome. Sounds like it's easy to get in there. Any other thoughts on this?
We are everyone here in the outreach team, Lulu, myself, Athena. I think we're so excited to share this opportunity with New England. We need about 300 more people to join. So you can call us. We would love to talk to your friends about this. Get your own little pod together. And like I said, we want to answer all of your questions so you're 100% comfortable. So however long that takes to do so, we're more than willing to do that.
And for my viewers out there, I know Tara and I are in a lot of things together. She really does mean what she says. She will take as long as it takes to answer your questions and make you feel comfortable. She'll speak to you in whatever language that is best for you to understand. And if it's a combination of both, then that's fine too. This information is really important, that the research be done to keep us all healthy, because it's not just about you or me, but it's about all the people who surround us and love us, and they'll be impacted by this too. So if we can stay healthy longer, we can stay independent, and that's all of our goals, right?
Absolutely.
So give them a call, 401-764-6837, or you can email to it, pointer@butler.org or butler.org/pointer. Do they need to have computer access for your study?
So it's definitely recommended to have computer access, but we, in order to sign up, we can definitely send them a mailed packet if they don't have a computer, or we can do it over the phone.
Perfect.
Computer access is encouraged.
And you ladies really do answer the phone.
We do.
Yes, we do.
Directly, yes.
Real people answering the phone,
Real
not an automated press 1, press 2, pat your head, rub your belly. Real people.
No, you'll get one of the 3 of us right now, and you know, we'll be more than happy to talk with you.
Awesome. Thank you so much for coming on today.
Thank you for having us, Deb. It's always good to see you, and I hope everyone stays safe and healthy this weekend with the hurricane coming up.
Yes.
Absolutely. Thank you.
Take care.
Okay. Bye.
So everybody, seriously, you know, you might be a little nervous about whether or not dementia runs in your family, that kind of thing. Here's a great free opportunity to have that get checked out. You can have a great conversation, find out if it's for you. Nothing really invasive. So how cool is that? And you can get information that you can pass on through the generations that can keep them all healthy. So do it for your family. That's awesome. Pointer Studied is just a really cool study, and it is not hard. So give them a call over there at the 764-6837. You know, the women will be more than happy to talk to you. I just encourage everybody to get out there and participate. I want everyone to be safe this weekend. And real quick for my veteran friends, I am with you. If you need to talk, you can always reach out to the crisis line. You can give me a call. I know this week has been really pretty rough for some of my vet friends. And I just want to acknowledge that, and I stand with you. So I look forward to seeing you all next week. Stay safe in the storm. If you need to reach out, if you need help, give me a call, the 585-0509. You can always email me at deb@rielderinfo. You can always find lots of information on rielderinfo.com. I look forward to seeing you all next week. Be well.
If you liked this video, please follow us on social media and subscribe on YouTube. For more information, visit rielderinfo.com or call 401-585-0509. If you have any questions, email deb@rielderinfo.com.